Can we meet you? Your name?
Yeah, I'm Dr. Adekunle, the Medical Director, General Hospital, Suleja, Niger State.
Okay. So about the rehabilitation of Suleja General Hospital, why now?
Well, let me first say it's remodeling.
Okay.
And maybe you can say reconstruction. And we say why now?
At this time.
At this time.
Yes.
Well, my take is that time of doing the project is not as important as getting the job done. And basically, if I want to give you the right answer for why now, it's because now the fund is available. It's a concept that the present government, under the able leadership of His Excellency Alhaji Dr. Abubakar Sadiq Sonibelo, it's a concept they conceived for the past 6 years plus. That was 2016, and that's when we have this. Want to reconstruct, remodeling General Hospital, Suleja, Minna, and Kotangora, to look like the modern hospital. Some of them, like this place, is about 53 years old. So, but the plan was on, everything, the architectural drawing and everything was ready as far back as 2016. And we wanted to move to some other areas so that they can do the work at once. But unfortunately, there's no fund. But now, there's fund. And not that they want to start and stop. The fund that is going to complete the project is available. And that's why the government embarked on it. So to me, it's better to be late than never. So
exactly. So speaking of remodeling, a lot of grievances from the people out there. So what are your plans for the patients and the sick persons?
I think the first thing we should look at is that what do we stand to gain by remodeling this hospital? We should dwell on the good aspect first before we look at the pains we are going to go through. Certainly there are going to be pains. What are we going to benefit by remodeling this hospital? I will start by saying, first of all, the number of beds as at today for this hospital is just 166 bedded hospital. It's going to be upgraded to 250. So that's an addition of almost 100 bed space, which I think a lot of us need to look at. People that come here, most at times, if not most of the time, we see that patients have to be referred to another sister hospital because of lack of bed space. So that's a plus. Two, most of these buildings are old and outdated, if I can use that. They are obsolete. So we need an environment, a place that when patients come, they will see that, okay, this is an hospital. This is where I want to come and get well. The kind of structure we are going to have now is so superb, and the way they are going to build it is going to be perfect. For example, antenatal clinic, antenatal ward, and maternity, they are just in that sequence. So you don't need to move miles within the hospital. As you are leaving one place that is more or less the step place for you, the first place for you, you will get to the second and third. So it makes things a lot easy. The chat flow of patient will be a lot better. There won't be a kind of a patient, inpatient and outpatient mixed together, because basically the general outpatient department is in the other side. So if you don't have anything doing the inpatient, you won't mix them. Another thing that we are going to have accident and emergency separately, close to the gates. So as you are bringing them in, they access that place. Accessibility to any department you want to go is a lot easier with the new remodeling. So I think it's going to be a lot better. Those are the things we have to look at. The pains. No gain, no pain. No pain, no gain. You have to go through some pains. And that's why the government, out of their wisdom, they believe that these things will just be 6 months. And what we did is to reach out to our people. I'm so happy that your media is coming to hear from us, which is one of the things to really let people know what is going on. We took some decisions, and we look at it that, okay, we have different type of patients. We have a pregnant woman. That means each time you have a pregnant woman, you are dealing with 2 or 3 life or more. So you don't want them to go through stress. So basically, For now, all our maternity cases, our pregnancy services, let me say obstetric services and gynae services, still domicile here. You don't need to go around. Our maternity is a modern one, so we don't need to, the government does not need to touch that area at all. So we still provide the services in this place. We also look at our special patients, patient on ART drugs, HIV patient, patient on tuberculosis drugs. We don't want them to go far, and we don't want, most of the time they are indigent patients. By the time some of them come all the way and get to the hospital and they need to move again, that this is not, they have been moved to this, it's going to kind of consider a lot of burden to them. So we are still going to use one of the flats in the quarters to house the ART clinic. They are basically outpatient. They will come assess their drug. Most of them 3 months, most of them 6 months. TB come every month to assess their drug. So those people are still staying and they are going to receive their treatment within the hospital premises. The next stage of the client we are considering national health insurance patient, hypertensive patient, diabetic patient, psychiatric patient, orthopedic patients, and family planning patients, clients. We have another 6-star hospital, which is a primary health care center. That's a Planned Parenthood Federation of Nigeria, PPFN. It's just across the road. You just cross. You don't need to enter any transportations or Okada. You just cross and access your services. It's also outpatient cases. So these are the things we provided for people so that they won't feel the burden. Then we now have adults, both male and female, surgical and medical, and pediatrics, both male and female. We have them at the hospital Bayan Kaswa, that's the town clinic. If you go to the town clinic, it's a modern primary health center that built by this Millennium Gold something. So it's a standard and can accommodate that. And it's also at the act of the town. But why we pick that place is that it's also centrally located. Accessibility for people to come there is also a lot easy. Although there are some challenges because for you to carry your car, your vehicle to that place might be a bit difficult because of these casual people that normally take over the road. But they are human beings. We are going to talk to them. The community, there will be a community engagement which we've started. I just had a meeting with the youth this morning where I tried to enlighten them about what is happening. And we are going to make sure we have engagement with the market women, with the National Road Transport Association, and then we have been communicating with local government. Local government is the one that gave us the place. They've started talking to the people in that area. We have been engaged. We've engaged the Emirates Council. His Royal Highness was here today to see what is going on. So we are doing everything humanly possible. We started putting jingles on radio, FM Suma, to let people know what is going on. I've been on live program in that FM Suma last Saturday or there about people talk. A lot of people, there are fears some people raised, and I'll be able to explain to them. We have to do this. We have to go through this pain if we really want to enjoy what we have after.
Okay, so what's your goodwill message to the people out there?
Well, my goodwill message is this. They should please, let's enjoy these challenges, this difficult time. I must tell you there's going to be a lot of challenges. When you came today, you see the way the hospital is. Both the staff and the clients are going through some challenges. There is something that we can bear. It's something that if all of us work together, things will be of something, those pain will be of the past by the time we finish this project. Another important thing is our collective responsibilities. Everybody must make sure that this thing come to be a success. And the only thing can be a success that is 6 months. We should hold government accountable. It should be 6 months. After 1 month, let's come and see the level of project. After 2 months, let's come and see it. So that we know that is this project achievable with the time bound we have. That means that all of us have to be monitored. There should be a monitoring and thorough evaluation of this project. If we can do that, I'm sure that there won't be a problem. And then, like I said, some people raise their fear about abandoning project. I don't think this government will do it because the money is there. So I want to appeal to people. They should please bear with us. Those places I've mentioned that we are going to provide services for them. Anytime they have issue, they should go there and access the services. If there's any problem in between, they can walk to my office. I must tell you that by the time they start renovating where I'm sitting now, I don't have office, so I have to be mobile. My car have to be my office. These are the things all of us need to go through and make sure that this project is a success. Thank you.
Thank you so much.